Everyone. Hi, everyone. My name is Jessica, and I'm one of the co-founders of Fair Care Idaho. I'm also a mom, and for the past 14 years, I've been the full-time caregiver for my son who has complex medical needs. Like so many other parents across Idaho, I didn't set out to become a caregiver, advocate, scheduler, therapist, and case manager, but that's what the role requires when there's no one else available. Today, I'm here to talk about the economic impact of family caregivers in Idaho and why it matters more than ever that we protect and improve the systems that support us. What is PCS and FPCS? Let's start with something that has created a lot of confusion for families and even for some agencies, the difference between PCS and FPCS. PCS stands for Personal Care Services. This is a Medicaid service that helps people with disabilities get the assistance that they need with things like bathing, dressing, eating, mobility, and other daily tasks. PCS has existed in Idaho for years and is typically delivered by a direct care support professional, a caregiver hired through an agency. FPCS stands for Family Personal Care Services. It's not a new type of service. It is the same service delivered by a parent, spouse, or legally responsible individual who gets paid for their caregiving time. The qualifications to receive PCS or FPCS are exactly the same. The only thing that changed during the pandemic was that Idaho allowed legally responsible individuals to be paid caregivers. Unfortunately, the name Family Personal Care Services made it sound to some like it was an entirely new benefit or program. It wasn't. It was a more flexible way to provide the care people already qualified for. And now that the program is ending, many families think they've lost the right to receive any care at all, which is simply not true. But it feels that way when no one else is available to hire. So let's be clear. PCS, the Personal Care Services Program, still exists. What changed is who is allowed to provide that care. Here's a simple way to think about it. Biological or adoptive parents, those listed on a child's birth certificate, are no longer eligible to be paid PCS providers of their own child. However, other family members, like grandparents, adult siblings, uncles, aunts, or step-parents, can be paid providers as long as they meet the usual qualifications. For spouses, the rule is similar. If two adults are legally married and there's a valid marriage license on file and no divorce decree, then one spouse cannot be paid to provide the care for the other under PCS. The overall fact remains, without the FPCS waiver, many disabled individuals, especially in rural areas, have no realistic way to use personal care services, the benefit that they qualify for. And that's because Idaho's caregiver shortage is the worst in the country. Idaho's caregiver shortage isn't just a staffing issue, it's a full-blown crisis. Between 2020 and 2021 alone, Idaho lost over 2,600 caregivers. By early 2025, testimony confirmed that Idaho now has the worst direct care workforce shortage in the country. This isn't just affecting older adults, it's affecting kids like mine who need complex care every single day. An independent survey of Idaho agencies shows at least 850 participants will be left without a caregiver now that the family caregiver program is ending. That number keeps rising. Ending the program doesn't solve the crisis. It makes it worse by removing the only available caregivers from hundreds of families who still qualify for services. Why this makes economic sense. In 2024, Idaho spent $8 million on the family caregiver program. Yes, more than originally budgeted at $4.2 million, but that number needs context. Here's the real story. Based on the population size of Idaho, the budget projections severely underestimated the number of Idahoans who would qualify for services based on the state's established nursing review process and criteria. Institutional care costs the state at least $85,800 a year per person. On average, the average cost of PCS is $50,835 a year for a full-time family caregiver. For medically complex children who qualified for skilled nursing, the savings are even more dramatic. Paying an RN for 40 hours per week would cost over $166,000 a year. The only way Idaho saves money is if eligible individuals don't actually receive the care they qualify for and require because no one is available to provide it. In my case and many others, we could qualify for up to 40 hours per week of private duty nursing, but instead we used FPCS because I was available to clock out from paid care time and meet those skilled needs myself. That saved the state well over $100,000 per year and kept my son at home, safe and thriving. If just 500 Idahoans avoid institutionalization through this program, the state saves nearly $39 million a year, not to mention all of the emergency room visits, temporary crisis placement, short-term hospital admissions, group home placement, and/or assisted living placements. Ending FPCS is not a policy win. That's systemic failure disguised as short-sighted budget savings. What happens when this program ends? For most families, there are only two options. They continue to provide the care, but for free, or they burn out and the child or adult ends up in a crisis placement or an institution. Both outcomes are bad, but the first one isn't free. It just shifts the cost onto already exhausted families and pushes them into poverty or dependence on other forms of public assistance like SNAP, housing assistance, SSDI or SSI, and Medicaid. Let's talk about what FPCS actually paid family caregivers, about $13.25 to $16.50 per hour. Modest wages in today's economy. Now, contrast that with agencies who are reimbursed $24.44 per hour to provide PCS. Out of that, they must pay wages, taxes, and administrative costs, making it very difficult to recruit or retain workers, especially in rural areas. And when family caregivers are removed, it's not like a higher paid professional steps in. Often there's no one available. Here's something hopeful though. As FPCS caregivers joined the professional care workforce, many gained access to benefits like health insurance, dental, vision, and retirement savings. That's not a handout. It's a pathway out of government assistance and into stable employment. This program didn't just save money, it created jobs, stabilized families, strengthened our rural communities, and improved Idaho's economy and tax base. We also have to talk about unpaid caregivers, because even without this program, caregivers are holding up the system. Nationally, unpaid caregivers save Medicaid and Medicare between $130 billion and $873 billion annually. But families lose $522 billion per year in wages, job growth, and retirement. Over 4 million family caregivers rely on Medicaid themselves, not because they're unwilling to work, but because caregiving is their full-time job. In Idaho, when we invest in caregiver wages, even modest ones, we're recognizing the real economic contribution of people who are already doing the work. We're not creating an expense. We're acknowledging one that already exists and shifting the burden off the backs of struggling families. This isn't just about money, it's about the law. Ending this program also puts Idaho at legal risk. Under federal law, people with disabilities have the right to receive care in the least restrictive setting possible. That means at home with proper support. The Department of Justice has already found Idaho out of compliance because of limited access to community-based care. In other states like Colorado and Indiana, when caregiver programs were cut, families sued. Courts agreed that removing paid caregivers violated federal law because it forced institutionalization. Idaho is already on the DOJ's radar. If the state continues to limit access to care, they are likely to face expensive legal challenges and federal oversight, expenses that could far outweigh the cost of finding workable solutions to the caregiving crisis. I want to shift gears for a moment and talk about advocacy, because that is something that every person can do. When I talk to legislators, I don't come to them with demands or rattle off a dozen statistics. I introduce myself, I tell them about my son, I explain what our days look like, how many alarms I set, how many supplies I track, how much sleep I lose, and how much it means to just be his mom instead of always acting as his caregiver. I help them see us as people, not numbers. Most importantly, I offer solutions. Right now, we're working on a legislative draft for 2026 that would bring back family caregiver payments under a more sustainable and transparent model. We're not just asking for funding, we're helping build a better plan. You don't need to have the perfect words. You just need to tell your story and show lawmakers the real-life impact of their decisions. That's how change happens. What we need to move forward. We know the program isn't perfect. It needs better training, clearer communication, and stronger oversight, but none of that requires ending it. We need a renewed system that allows family caregivers, including parents and spouses, to stay in place. A commitment to a stronger, more accountable system, not a more expensive one. Recognition that parents like me are not a backup plan. We are the front line. This isn't about politics. It's about people, about kids and spouses staying with their families, about preventing burnout and poverty, about allocating government resources wisely, doing what's morally and ethically right, and avoiding costly lawsuits. That's why we created Fair Care Idaho. We're a grassroots coalition of caregivers, self-advocates, and allies working to protect and improve access to home and community-based care across the state. Our mission goes far beyond a single program. We believe no one should be forced into institutional care due to workforce shortages. Parental and spousal caregivers deserve recognition, support, respect, and compensation. Transparent, collaborative policy can improve outcomes and reduce costs. Disabled Idahoans have a right to choose where and from whom they receive care, and that stakeholders deserve a seat at the table when life-altering decisions are being made. We've already started working on draft legislation for 2026, but we can't do it alone. If you are a caregiver, advocate, provider, or policymaker, we'd love to connect. Visit our Substack, Fair Care Idaho, to sign up for updates. Email us if you want to partner, share your story, or get involved. The more voices we have, the stronger we are, and the better chance we have of building a system that truly works for Idaho families. Thank you again for your time and for everything you do to support caregivers. Have a great day.